Before we get started, the views expressed in this podcast are designed to be general in nature and should not be used to substitute for personal medical assessment. Maybe extra topical in this podcast. We're talking about COVID vaccines. We're talking about COVID itself and the effect that it has on athletes and their hearts. What currently do we know? We're speaking in November 2021 for context. What do we currently know about athletes and COVID and the vaccine and how it's all played out so far?
Yeah, so we had to have a crack at this, didn't we? It dominates every single conversation. Part of me thinks, it's so covered, it's boring. But there are some really relevant things for athletes. It also very much, it's important to realise that everything that we talk about with COVID, when you watch the news, is kind of presented a little bit binary, good, bad, whatever, whereas everything is a spectrum. So, for example, when we talk about COVID with athletes, the vast majority of young, healthy athletes who get COVID will have a mild illness and will recover. But there is the small number of athletes who will, for reasons we don't understand, who can become very sick. And because there's so many people get infected, there will be young, healthy athletes potentially who die. But on average, one of the strongest predictors of how you'll go through COVID is your fitness. And if you like, everyone understands that age is important. Older people tend to become more sick and older people are more likely to die. It probably is that biological age is more important than chronological age. What I mean by that is that some people that are some very fit and healthy 60-year-olds are in fact, biologically younger than some unhealthy 40-year-olds. And that biological age and fitness as a measure of that has been shown in several studies to be a really important determinant. So if you're fit and healthy, you're less likely to get very sick with COVID.
Mm. Similar to, I guess, like we've been talking about through this podcast series around the risks that athletes face for doing too much exercise.
Yeah, and I think that there's exercise and how the body responds to that is such a healthy thing in almost every domain, and COVID's proving that again. That in a way, COVID's interesting because if you get sick with COVID, what the illness does is reduces the oxygen to the blood. A lot of the toxins associated with the virus result in you dropping your blood pressure. All of these things require you to increase your cardiac output, and athletes are very well trained to do that. So even if you become really sick, you're more able to cope with that if you're well trained and you're athletic. What I meant before about it being sort of non-binary is that if you just sort of rest on the laurels, and there's some good examples of this, but if you sort of say, look, it'll never happen to me, you can be very unlucky. And there are some very fit athletes who have become very unwell with COVID. So I can't give and no one can give an insurance policy. And it's a very common infection. So I'm not for a moment saying that athletes are sufficiently unlikely to get really unwell that they can forego the vaccine. We'll get a chance to discuss, but there's a number of reasons why people should get vaccinated that extend beyond just your own health risk. But certainly it also would be incorrect to suggest, it is important to emphasise that athletes who do get COVID are unlikely to get very, very sick with it. We've studied a few professional athlete groups. We studied a team of professional basketballers, and some of them were really laid out, 3 days of feeling absolutely terrible. But they all recovered. They all recovered completely. We put them absolutely through the ringer. We did MRIs, echocardiograms, exercise testing, heart rhythm, everything. And we found nothing at day 10 to 14 after the illness. So, and that fits with other studies around the world where people have looked at elite athletes, elite and non-elite athletes, that they tend to recover quickly and recover completely. But on the other hand, again, in the basketball team that we studied before the vaccine was available, I'm sure they would have preferred to have a mild illness than 4 days of feeling absolutely terrible lying in bed. So already, I'm sure if you ask those people who were infected, that they would be very pleased to have had a modified illness through a vaccine. So it's not all just about whether you'll survive or not. It's also whether you can avoid, a week lying in bed feeling absolutely shocking.
The cycling news media potted up this week as one of the highly successful athletes is in hospital with COVID. Like what do you read? What do you read into those kind of reports, and what are they actually saying in terms of what does that mean?
Yeah, so Pozzato, I think, is in hospital with really quite severe COVID illness, and he had low oxygen levels or desaturated and was taken to hospital. On the other hand, you have athletes like, I think, Bernal after the Giro d'Italia contracted COVID and seemed to just have little or no symptoms. And that just shows the variability of the illness. One person's fine, the other one's very sick. What it does tell you, and Pozzato was very outspoken himself, saying, I thought I was kind of too fit, too well to become so became a bit complacent. And there's a really important message there, because he's like the picture of, he's an extremely healthy, middle-aged, even young middle-aged elite athlete who's ended up in hospital desperately unwell. So, I wouldn't be playing the odds and saying, look, 95% chance I'll just have a mild. I would be thinking, one, I'd rather have a mild illness rather than be laid up in bed. And two, I don't want to take the odds of the unlikely but chance of being desperately unwell. And he said that very clearly. He said, I wish I'd not been so stupid.
Is the research world getting involved in the actual athletic effects for athletes in terms of their heart, and then also what COVID and the vaccine means for them?
Yeah, so particularly in the post-COVID world. So competitive sport in the US and Europe, particularly there where there were many more infections. And one of the questions that came up was, can people get back onto the sporting field? What test do we need to do to check that they've not had any sort of heart problems from the virus? And initially when we were when we had less information available, there was really quite a cautious approach taken. And so we were tending to do blood tests, imaging. And then with the passage of time, we've realised that people who have little or no symptoms, people who have mild illness, the chances of them having problems that create any issues in what we call return to play or getting back to competition, are so remote that we don't need to do massive screening campaigns. In other words, in short, if you have a mild illness, you're going to be fine returning to sport. If people have a more significant illness, then it is worth seeing your doctor and potentially getting some tests done just to check that everything's fine.
You touched on it before around the effects of your cardiology and the respiratory system. Can you just run us through what's actually happening to the body and how the cardiology system's involved in that?
Sure. So COVID is kind of described as a multi-organ or generalized illness. So it does affect a lot of the body systems. Having said that, the predominant issue is inflammation, and particularly inflammation of the lungs and to some extent the blood vessels. So by inflammation, what that means is kind of a bit like having a skin rash and having a build-up of pus cells. Those things happen within the lungs and within the blood vessels. In the lungs, the consequence is that it stops the air getting in, or oxygen getting in, so you become very short of breath, and oxygen's needed to perfuse or to give nourishment to the brain and to the muscles and everything. So in really severe disease, that's the biggest problem. Then you have sort of some bystander problems, like in the blood vessels that are inflamed, you can get clots developing, and those clots can cause what we call pulmonary emboli, or sudden blockages to the lungs, or heart attacks through blockages of the blood vessels. The effects on the heart and the blood vessels and in some cases to the brain as well, they tend to occur in really severe COVID. So the heart is more caught up as a bystander in severe illness. And in people with mild disease, we really very uncommonly see problems with the heart due to COVID.
What about people that already have cardiology issues? Does it inflame or increase their risk?
It does. Interestingly, it increases their risk of having more severe illness. Yeah. Probably a bit to do with that biological age thing we brought up before. But then if they become unwell, there's less what we call reserve, or less, like I was saying, that the athletes can generate more output from the heart. If you've got a problem with your heart, and there's a ceiling on what it can do, then if you don't have enough oxygen, there's problems with your lungs, your heart needs to pump more around and it can't, then that's unfortunately curtains time. That's when people do die, when there's not enough reserve in the body's organs to get past the illness. And unfortunately, and one of the reasons there is all this emphasis on vaccine is that there's not great treatments once you get it. There are some treatments available, and there's some that are being tested and might come out, but none of them are brilliant. So if you become really sick and you're relying on things like steroids, then you're already deep into the fourth quarter.
Yeah. So that's the COVID effect on the cardiology system. Then the vaccine effect to the other end. What do we know about that currently?
So the vaccine effect from a cardiology point of view is really interesting. So basically the vaccine is very effective at reducing severe illness. It's also moderately or very effective at preventing you becoming infected. But certainly if you become infected, it prevents you from severe illness. And as a result of that, you're less likely to get severe inflammation of the lungs and the side effects on blood vessels and the heart. If you like, the downside of that from a heart perspective is that with exclusively the mRNA vaccines, so in Australia, Pfizer and Moderna, there is a risk of the heart causing inflammation. And that seems to be as common as the virus the virus itself. So for that one problem associated with COVID, the myopericarditis, myo means heart muscle, or myocardium, heart muscle, and the itis means inflammation. So you get inflammation of the heart muscle, and pericarditis refers to this layer around the heart that sort of lubricates the heart, and that can become inflamed. So that myopericarditis can occur with the vaccine. It also can occur with COVID, and they occur about the same extent. So you'd sort of think, well, hang on, why would I take a vaccine if the side effect is as bad as the virus itself? That's because, one, it's uncommon, myopericarditis with the vaccine and with COVID, but also it's by far the least serious of the COVID problems. So the one problem with that type of vaccine is the least of the problems with COVID, if that makes sense. So it's I suppose the other question, why do you get it? So taking a step back, the way that vaccines work is that the reason we have an immune system is you need to protect yourself from external things getting in, if you like. So our immune system attacks bad things that come in through our food, through the gut, have an immune system all through the gut lining, through our lungs, on our skin. If you don't have an immune system, it's extremely dangerous. The way that, when we've got a new virus, we want the immune system to fight that. But the first time that it sees a virus, it takes a while for the immune response to happen. So the vaccine is designed to stimulate the immune response to the COVID virus. What the problem with the vaccine can be is that immune response that protects you from outsiders can sort of overlap with some of the tissues in the body. We call it autoimmunity. So the response to the vaccine saying, I want to create sort of immunity to COVID if it comes, but there's something in the vaccine that is similar to the heart muscle and the lining. That means that in some people, uncommonly, it can overreact and you get inflammation against your own heart and heart lining tissues. It is said to occur in about 1 in 20,000 people. It's more common in young people. Frustratingly, it's more common in young males than young females. It's been reported in US military recruits to occur in about 1 in 20,000 people. The experience of cardiologists, and you've got to remember that we're the ones who see, myopericarditis. It comes to us. Our feeling is that we're seeing it significantly more commonly than 1 in 20,000. That's not really a surprise. Often when you first see something, you don't realise how common it is. There's a bit of a saying, you can't diagnose anything until you know about it. So it probably is more common than that. It's still uncommon. I wouldn't say it's rare. It is the problem with these side effects, the vaccine, is that the side effects are most common in the people who have the least to benefit in a way. So young people are the least likely to get really sick, and yet they're slightly more likely to get these side effects, which is frustrating. At the same time, we've got to remember that even then, it's a side effect that tends to be mild, and I'll come back to that, but it's also, it's still overall much less likely that you'll get sick from myopericarditis than you would from the virus. Myopericarditis, when we see it, tends to be mild and tends to recover completely. Even though I've seen, several cases of Pfizer and Moderna related myopericarditis, they have all been mild and they have all completely recovered.
That was my next question. So if you are that 1 in 20,000, like, what do I feel like when I'm coming to see you? And then what are my odds once I become that person?
So myopericarditis is quite a distinct syndrome. It most commonly occurs from half a day to 5 days after mostly the second dose of either Moderna or Pfizer. It can occur after the first dose, but mostly the second dose, half a day to 5 days afterwards. Again, that's the most common. There's some variability. And people will present with really quite significant chest pain that is worse in movements, things like sitting forward and also in taking big breaths or coughing. Sometimes there can be a little bit of sort of heaviness or a feeling like a pushing on the chest, but mostly it's that sort of worse pain with breathing, and it tends to respond well to anti-inflammatory medications. No one wants inflammation of their heart, and it's something that we take seriously, and especially in young healthy people. And so we watch people very carefully. The chances of having a significant complication from this inflammation of the heart is very, very small. So it's something that occurs very uncommonly. If it occurs, the chance of it causing serious problems is very, very low.
And this type of vaccine is the new vaccine. Is that the reason why there's still these unknowns attached to the connections and the possible outcomes of having the vaccine?
Yeah. So one of the concerns or critiques with the vaccines is that they've been pulled together very quickly. And it's funny because that's now seen as a bit of a negative, when in fact it's an unbelievable blessing. When this all started, people can probably remember the experts coming out and saying it's probably 3 to 5 years before we'll have an effective vaccine. And then, through the miracles and some very modern technologies as well, we've got, 5 or 6 or more vaccines that are effective around the world that have really had an influence on changing. It's saved millions of lives. So you've got the good side, which is that we've very rapidly pulled together a very effective defence. And then you've got the slight issue that we don't have a really good handle on the long-term effect of the vaccines. How can we have? They've only been around for sort of 12, whatever it is now, 12, 18 months, 12 months probably. So those doubts could be there. There's, to a degree, particularly some of the vaccines are alterations on quite established technologies where we've not seen long-term problems. Also, as time is going on, we're not seeing new things pop up. The side effects that we're seeing from the vaccines have all been short-term. So that is reassuring. The other thing with the vaccines is that even though they've been around for a short period of time, we have never seen any medication or vaccine campaign on this scale. So it is, we've accumulated. When you put together a study, you want to think about the power of the study, the ability to answer the question as to whether it works and whether there's side effects. And one of the ways that you try to work out whether you can do that study well is how many people you can have, how many numbers. And this has been done on a massive scale. And so we've been able to work out much more quickly than any other medication in the past whether it works and also what sort of side effects it has. So if you take, for example, AstraZeneca, which has the risk of thrombocytopenic thrombosis, or if you like, this immune blood clotting problem that got a lot of publicity. And the risk of that is about 1 in 500,000 people. You have to have a massive campaign to see a risk that is that rare. So if that were a standard medication, we would be realising that risk exists after 10 or 20 years, when we've got that many people that have used the drug. So the fact that it's been around for a short bit of time is important. But on the other hand, people must realise that we have never tested a vaccines to this degree ever before. It's been in millions and millions and millions of arms, and the side effects that we're seeing are either mild, myopericarditis, for example, or extremely rare and serious, like the thrombocytopenic thrombosis. So the risks. People have said, another drug that might be used on this sort of scale is something like the oral contraceptive pill. And we don't read about the side effects every night on the news, but it is responsible for young women having strokes, for example, at a higher rate than if they weren't taking it, and probably on a sort of similar scale. So there's a lot of focus on this, and the side effects are rare and generally mild compared to any other medication, vaccine and things like that we've seen in the past.
When vaccines do get launched and rolled out, is it common for them to have long-term effects? Is there genuine, I guess, credit to that concern?
Yeah. I mean, there hasn't been in the past. So I'm not aware of any vaccine sort of technology or rollout that has then resulted in sort of long-term side effects. There are, that's, if you like, my view, that's the mainstream medical view. There are people in society who do believe that vaccines have significant long-term side effects that are being unreported or being underreported. But again, vaccines are one of the most commonly things administered through society, and we don't see long-term side effects. It's also interesting when you think about some of the dirtier vaccines. So when I was younger and went to South America, you had to have a yellow fever vaccine, probably still do. And that was associated with probably one of the higher side effect profiles. And you didn't sort of think twice. Wanted to go to South America, bang in your arm. It's just, I do find it a little bit intriguing. And what was the risk there? Like, was I really going to get, the chance of becoming unwell with it was so remote, yet you line up for this vaccine. Now you've got a virus that's ripping through society and killing millions of people, and you sort of go, oh, do I want this vaccine? It is funny how things have shifted.
And everywhere. It's not just in a specific reason. It's the globe's got it. I guess the two big scary players are big pharmaceutical companies and government.
Yep.
Two not so trusted bodies of people.
Yeah, and I share that skepticism. I mean, you can look at it from the prism of there's some drug companies making an absolute bomb out of this. You can also look at it the other way and say, well, they kind of deserve to because they're saving millions of lives. But really, I do understand that. I think it's good to have a natural sort of cynicism. And the question about making the vaccine mandatory is probably something that we could talk for hours on. And it is an interesting discussion. The pros of it is that it's not all about you. I mean, I sort of touched on it before, but one of the things for young people getting vaccinated and young athletes, if you take what I said before, which is that young, healthy athletes are the least likely to be admitted to hospital and get severely unwell, then, and there's this small risk of a vaccine, maybe the benefits slightly outweigh getting vaccinated in terms of but I often say to young, healthy athletes, the main reason for getting vaccinated is not in a way to protect you. It's to protect mum and dad. It's to protect the business owner down the street. It's to protect, the lady with breast cancer who you bump into who had her vaccine while she was having chemotherapy and doesn't have good coverage. The main reason to get vaccinated is so that your chance of getting the virus and passing it on is less, one. And the second is to enable us to open society, because people, often the same people, the ones who are saying, don't want to get vaccinated, then saying we need to open up society. It's very hard to have both. If we're not vaccinated and we open society, then we really have a problem. We have a problem where we're sitting now in the hospitals. We have a problem throughout society. I don't believe that there's anyone sensible who thinks that's an option. So if we want to have people not experiencing the mental health side effects, if we want our kids to still learn in schools, the only way out of this is vaccination. So in a way, if the government were to be brutally honest with the public, it'd kind of be saying something like, young people out there, school kids out there, we want you to go out and get vaccinated, not because there's a huge risk of you becoming really sick, but because it's an altruistic thing so that we can get back to the life we want. And for me, throw the vaccine in my arm any day of the week if I can get back to the sort of lifestyle that we enjoyed 2 years ago.
Yeah, indeed.
I don't know. I think it's a no-brainer.
Maybe there's a role for you in the future health minister of the country, Andre.
The problem is, and I sympathise for them, but the government have to create a bit of a black and white message. My critique is that I believe that there's been too much emphasis on get the vaccine or you're going to end up really sick or dead. For young people, I think that is a real message, but it's very, very rare. The real reason for young people to get vaccinated is, as I just pointed out, to protect the vulnerable and to get back to a normal life. And they're really, really compelling reasons to get vaccinated.
Yeah. The other argument that you see pop up is, I've had COVID, I've got the antibodies. Yep. Why would I take the risk of getting the vaccine, which is in theory going to do the same thing?
Yep. And that's a really valid argument. I mean, there's the best, we don't know this for sure, but every other illness would tell you that the best immunity you can get is to have the illness. And so if you've had COVID, you have, at least for a while, likely to have good protection. There are cases, there's many cases around the world of people getting COVID more than once, and particularly if it's a variant, but they tend to have a mild illness the second time, much like we have with vaccination. The problem is that we can't easily identify whether people have had COVID in the past. So antibody tests are expensive and not particularly reliable. So if we just went around and said, put your hand up if you've had COVID, people would get it wrong. And there's no way of easily checking. So the reason that that falls down, I've had COVID, so I don't need to get vaccinated, is not because it's sound science. It's just because we can't work with it.
Doesn't have scale.
And it just doesn't have an easy and reliable way for us to test for that.
Yeah. So there's also benefits too. If you've had COVID, going to get vaccinated.
Yeah. So the one interesting thing with the vaccination, and this is where boosters are coming in, is that it seems that if you've either had COVID or if you've had vaccination and then you have a top up, then the vaccination you get is really the immunity you get, is very, very good. So if you've had COVID and then you have 1 or 2 doses of vaccine, then you're kind of super immunized, if you like. So there's a lot of benefits.
Yeah. The benefits that you were talking about before, passing it on to your mum or your grandparents, how much of that do you get from having the vaccine?
Yeah, so the initially it wasn't clear. So initially it seemed that the vaccines were good at preventing people from getting very sick, but there was uncertainty as to whether it reduced transmission. It's now clear that it reduces transmission as well. Not completely, and there's nothing binary. So if you're vaccinated, fully vaccinated, it doesn't mean that you can't get really sick. It doesn't mean that you can't even die from them. It just reduces the odds dramatically. So, instead of your risk of being severely unwell being around 10%, it goes under 1%. Similarly, it doesn't mean if you're vaccinated that you can't pass it on, it just makes it less likely. My understanding is something like 60-70% less likely. And that's where this kind of concept of herd immunity, the more people you have vaccinated, even though each one can pass it on, if you reduce that by 2/3 and you get a whole lot of people, then the whole sort of transmission starts to be broken and you end up with few cases.
Yeah.
And when you think about the people who cannot get vaccinated. So we do research, for example, on kids who have chemotherapy, and particularly some types of chemotherapy, they cannot be vaccinated against COVID. So their only protection is how well the rest of us get vaccinated. And I would hate to be living with some sort of concept that my actions contributed to, a 14-year-old kid who can't get chemotherapy or who has had chemotherapy or something, can't have the vaccine, becoming severely unwell or dying. I mean, that, although you sort of think, that's unlikely, you're taking an extreme view, that is how someone is unlucky enough to be in that chain of transmission for that to occur. And the less likely we make that by us all getting vaccinated, the better.
And that same message flows on to, we're coming into booster season. Everyone's starting to get some months in the bank of having 2 shots. That same benefit still applies. I know there's a bit of concern around the people who've had that first round of vaccines and been sick or ill or had some couple of days of symptoms from it.
Yeah.
The benefits still lie in that extra shot?
Yeah, it seems so. I mean, I must admit, I take the view that, 9 out of 10 or 90% of the problem solving is in getting people vaccinated. I think at the moment there's a little bit of almost interference being called about the whole booster debate, because if we had everyone fully vaccinated, that's really the key. There certainly does seem to be some immunity waning. So particularly overseas, we're seeing people who have been vaccinated more than 6 months ago, then being more likely to become reinfected. It's not like all of a sudden the immunity switches off and then you're probably progressively a bit more likely to get a bit more severe disease. So it does make it does make some sense. I mean, the other thing that we probably should discuss as well is that, can the vaccine, I sort of talked about myopericarditis, which is the thing that we see in cardiology as a significant side effect. But the other really interesting thing, and as getting some data from Belgium recently, where they interviewed their Olympic team, is that the non-specific side effects of the vaccines, which are annoying, they're not serious in any way, but for athletes can become quite significant. So they had some reasonably good data, and kind of a lot of it was interview based. Some of it was pre and post testing with the vaccine that showed for 2 or 3 weeks after the vaccine that many athletes felt like their performance dropped off. So you really didn't want to go and get your vaccine and then do the Tour de France next week or your key race. And what the person who was presenting the research said, which made a lot of sense, is you can prepare for a vaccine, you can't prepare for COVID. And what he meant by that was that if you're smart, you look at your training and say, right, here's 3 weeks of relative off season. I can train lighter for that. I'll get my vaccine then, and then just because everyone got back to normal, but for variable, but 1, 2, 3 weeks, some people really felt like their performance had dropped off. That makes some sense, because one of the things people might be, athletes listening to this will know that if they have a flu, even a mild flu, sometimes one of the earliest indications you get is you go and do your training ride and you bonk early, or you're missing a cylinder. You're like, what? And then you become sick 2 days later. Part of that is because the immune response with cytokines and different things, they actually can interfere with the muscle's use of oxygen. And so, when we give a vaccine, we're directly trying to stimulate the immune system that then can cause some problems with oxygen usage. It's such a tiny amount, but when you're used to measuring, if you know that you can sit at 340 watts and then you're at 320 watts, you're like, what's going on? And so, it really there's quite good experience that you might feel 10%, not the super athlete for a couple of weeks. And I think that's a really important thing. It's an important thing for planning immunization. It's an important thing for planning booster doses. But that would seem to me much better than saying, I don't want to get vaccinated, and then a week out from the Tour de France getting COVID and then you're in hospital. It's a dumb bit of planning for a sensible athlete.
Yeah, it was interesting. Well, interesting to your points just then that they had a Pfizer bus at the Tour de France this year.
Yeah,
athletes could just rock up any day they wanted to get the vaccine.
Yeah, and I think that there's a couple of issues, because they also gave the example of one athlete who had been vaccinated in the midst of an extreme training and racing schedule. He actually didn't feel too bad with the vaccine, but then got COVID. And one of their theories was that during really heavy training and competition, your immune system can be a bit suppressed. So it's not a great time to be getting vaccinated anyway. So, there's probably some theatre with having a Pfizer bus driving around the Tour de France. It's not when I would be getting vaccinated. And I think that's one of the things we've learned, is that athletes should aim to get their vaccination during a relative downtime, both for their performance and for the best immune response.
So once you get your vaccine, how long should you give it before you start getting back into whether you're riding the Tour de France or whether you're training for the Melbourne Marathon? How long should you give it before you get back into training?
Yeah, so I think it's sensible to take 2 or 3 days of really light training after the vaccine. There's some countries have kind of made that an official recommendation. I don't think the risks nor the kind of data around it is enough to be really scaring people. But it's just sensible. If you have a cold, or if you have a bit of the flu, you take a few days off, and essentially the vaccine is giving you a mild cold or a mild flu. It's stimulating the same immune process that we would get from a virus. So I would be saying the vaccine for me is the equivalent of a mild cold. I'm going to take a couple of days easy. Don't think you have to stop, but you just take it easy for 2-3 days. then go back into training, but expecting that you mightn't feel at your best for a couple of weeks.
Yep.
So I'd plan it out ahead of key training build-up or racing in a relative downtime, and not be afraid if you're not feeling your best.
Yeah. Another vaccine side effect that came up had the abbreviation POTS.
Mm-hmm. So POTS is postural orthostatic tachycardia syndrome.
That's why I wrote it down as an acronym, not
as POTS.
not
Yes.
the actual.
What does that mean? It means that it means normally when you go from lying to standing or sitting to standing, your blood pressure it kind of responds and keeps it even, or even increases it, and your heart rate goes up a little bit, but not much. Whereas in this syndrome, the ability of the nerves that control heart rate and blood pressure mean that your blood pressure doesn't go up when you, or it sort of drops when you stand up, and your heart rate tries to compensate by going really fast, and people feel washed out and feel terrible. Overlaps with some fatigue. It's a well-defined syndrome. It's actually interestingly been associated with post-viral illnesses and other illnesses like gastro for a long bit of time. Now, after COVID, so I suppose, again, one of my critiques of the messaging with vaccine has been to use long COVID as kind of a bit of a fear thing. So initially, people were always talking about long COVID. It's not just COVID. You got to think about they were, I think, quoting 1 in 3 people or more get this long COVID. That's not been our experience. Long COVID is not common. Like any illness, people can feel washed out and not well. But the people who really have ongoing problems are uncommon. One of the things that we think that we're seeing is an increase or we're seeing the occasional person, not common, but some people after COVID developing this POTS syndrome, which probably will improve with time. But it's almost like a hangover from the unwellness of the virus, where the nerves and blood vessels are not regulating properly, and it really can make people feel terrible. But it's not common, and it really would be one of my kind of slight biases that I think we've overplayed the message of long COVID, understandably, because they're wanting to emphasise the fear of the virus to get people to be vaccinated. As I've pointed out many times, I think there's really good reasons to get vaccinated without having to evoke fear of long COVID or POTS. It's uncommon. I don't think people should be racing to their doctor if they get COVID and certainly, or after the vaccine, and saying, I think I've got this POTS thing.
Yeah. The point before about the cancer patient that can't get vaccinated, is there a range of circumstances where there's a genuine reason not to get vaccinated?
Yes. So again, I've got my cardiology bias, but in people that have had myocarditis, because it's not just related to the vaccine or COVID, it is something that can occur due to other viruses or can occur just out of the blue. And so people who have had myocarditis recently, within the last 6 to 12 months, should not have one of the mRNA vaccines. People who have 1 dose of the mRNA vaccine and get myopericarditis should not have a second dose. So there are situations, they're uncommon, very uncommon, where there's patients where we would be saying you shouldn't be having an mRNA vaccine. In that situation, for example, if you're a 30-year-old and you've had myocarditis recently, you could then go and have AstraZeneca. It becomes a little bit tricky because the current recommendation is that that people under the age of 60 are not recommended to have AstraZeneca, or I don't know, not recommended, but the preference. I think the official wording is the preference is one of the mRNA, Pfizer or Moderna. I had AstraZeneca. I think it's a very good vaccine. Thankfully, or not thankfully, but I am under 60. And I, if I was in that situation, I would have AstraZeneca. I think it's a really good vaccine, and I think that again the side effects have been overplayed for AstraZeneca.
Mm-hmm. You talked about, it's also at the start, there's not a lot of cures or ways to prevent, not prevent, but treat COVID once people get it. Is that going to develop? Is that going to evolve? I
think it will. I mean, there's one of the lines that I was directed by a patient to a website about, not getting vaccinated because if you treat COVID early and treat it aggressively, then problem solved. But it was interesting to read because the doctor who was suggesting that line of treatment, early aggressive treatment, involved about 16 drugs, some of which were highly experimental and unproven. And so you've got a vaccine that's been used in millions and millions of people with established and rare side effects, or a cocktail of 16 drugs, including anticoagulants and antiparasitic drugs and monoclonal antibodies that would, one, cost an absolute fortune, but there's no way, for example, even a simple thing, we use them all the time in cardiology, I don't want blood thinners unless I need my blood to be thinned. And there's no way I would give me a vaccine over a blood thinner every day of the week. So, I'd be really careful. So basically at the moment, I don't think there's a single sensible person who would recommend the strategy of treatment over prevention, because at the moment the treatments for COVID are incomplete. They're not particularly good. They need to be used when people get very sick, but partly because we don't have a really good treatment. There are some drugs coming out at the moment where there's some hope that they'll be a lot more effective than what we've used in the past, but they're undergoing trials. The history of medications is that the side effects of medications tend to be greater than the side effects of vaccines. So again, I'd be really surprised if they become the dominant way of us treating in the short term.
Yep. Similar to a popular podcaster in the US, Joe Rogan, came out when he had COVID on his Instagram channel and reeled off about 16 different very long worded tablets that he was taking. And that's kind of like his argument is like, well, I've taken all these things. I didn't have COVID. Oh, I had COVID, overcame COVID. Now look at me, and I didn't have to take the vaccine.
Yes. So you could reel out, 95 out of 100 middle-aged or younger people who get COVID who don't take any medications and could say, look, I haven't taken anything and I've not got sick. I mean, I suspect that his 16 long-worded medications had absolutely nothing to do with him not getting sick. It's just that's how it rolls. Had he been one of the unlucky ones who gets very sick, like Pozzato, then you can roll out your 16 long-winded and he's in hospital getting best available treatment and is very unwell. So if it were that we had some panacea that would be great, then there's two problems. There's probably more than two, but there's two problems with that strategy. One, the medications just don't work well enough. But the other is by the time you've become really sick with COVID, you've had 2, 3, 4 days of being very infective. And so you're passing on the virus. And you might get away with it with or without whatever medications, but the person next to you might not. And the more we can protect, this is a clear example of where your decisions are not just about you. They're about all the people around you. And that is the absolute key message. And that is exactly why we're recommending vaccine to ages, to younger kids and teenagers, is on balance, in reality, their risk of getting really sick from COVID is very small. It's not nothing, but it's very small. The chances of them getting very sick from the vaccine is very small, smaller, but very small. But you've got competing rare risks. It's not actually about them. It's about protecting everyone else. But, my kids and all of their friends, that they're really pro-vax, and I've seen that time and time again. And thankfully for the human race, kids get altruism. They get that whole idea of protecting each other. Somehow we become old and jaded and a little bit selfish. But that's the reason. If you were to stand up in front of kids, why should you get vaccinated? It's to protect your mum and dad and your grandma and your grandpa. Done.
Is there anything else we haven't touched on today that patients are coming in with concerns about?
I think that some of the main questions that come up are that these are new vaccines, and what do we've discussed that. If we could have it any other way, we would. I mean, this is a really nasty virus. It's almost the perfect virus. It is very infective and very serious in some. If it were a more deadly virus like Ebola, it actually would then quarantine itself. One of the things with Ebola is you realise very quickly who's got it because everyone gets very, very sick and dies of it. Whereas this one's got that thing where it can pass through some people without having any symptoms at all. And then, 5 in 100 get desperately unwell with it. So it just rips through and so it's created the public health crisis of many generations. And we needed an answer, and vaccine is close to a perfect answer. Look, if we could have 2-3 years ago, or whenever this came out, said in 2 years' time we're going to have a vaccine that's 90% effective, 80-90%, everyone would have just been screaming in celebration. Then it rolls around and we start finding all these problems. I just find it really quite strange in the passage of history. It's I'm not writing off the side effect. There's definitely risks. There's definitely side effects. They're small, but my goodness, it's so much better than the problem.
Mm. Are we going to continue to see strains? I guess that's the other thing that us common men and women have learnt over the last 2 years, that there's strains of these viruses. We don't just have one COVID and that's it. Is there going to be more COVID strains?
There's strains and variants, and
the next Delta?
Fear the variant. So it's interesting because, for example, people will likely know, but the flu vaccine, the influenza virus is constantly mutating, and it's a seasonal virus. So it comes around in autumn, winter, goes away through the summer or goes to the northern hemisphere, and then comes back different enough from the previous year that you need to get a different vaccine. And the thought is with COVID that we're going to see a similar thing, that it will mutate enough that we'll need to have changed vaccines. One of the hopes, because our experience so far has been that the variants are more transmissible and maybe even a bit more, virulent or a bit more deadly than the type before. My hope is that the COVID vaccine will do that the COVID virus will do what other viruses have done through history, which is to generally mutate to a less deadly form, a less virulent. The virus doesn't want to kill its host. It doesn't want to get into someone and kill it, because then the virus dies. It wants to go on with, and through history, viruses have tended to migrate more towards the common cold that just gets passed around without it causing massive problems. So even though everyone keeps saying, let's fear the variant that gets more and more serious, there is the possibility that we get a variant that's less serious and very transmissible and becomes sort of a form of auto vaccination. We can't, of course, we can't just sort of go, let's just wait for that to happen and let millions of people die in the meantime. But just as variants may become a big problem, there is a small chance they could actually be part of the solution. Mm. That's part of my optimistic hope.
It's a good answer. I like it. Last question. There's going to be more COVIDs, different new viruses coming. Is the world in a better shape to go after it, to handle it, to get on top of it quickly?
I think so. Yes.
And medicine, in fact, and medicine too, with what we know now and the ability to develop vaccines. And
it's a very good question, because one of the other things is that through this crisis and the money that's been thrown at it, there's a public awareness all of a sudden of infectious diseases, and I think that the next virus that threatens our planet, we will get onto it earlier. People will be alert, in fact, probably hyper alert. And our systems of public health, contact tracing, all of those things are so much better than they've been. So we've learned a hell of a lot. the whole industry, science, this concept of mRNA vaccines and mRNA technology is now actually going into a whole lot of areas of diagnostics and therapies. Nothing to do with viruses, even cardiovascular disease, that may end up being really helpful. So throwing billions of dollars at the crisis of our time is going to have some benefits in medicine way away from the problem of COVID. So there's some really nice sort of off-label or off-target benefits that we're going to get from this. The downside is that I think COVID and it has been very socially divisive. It's kind of really strange. Although it's nice that it teaches us to think outside of ourselves, it also has highlighted highlighted divisions between people. We've not ever had the situation before where everyone wants to know someone else's health status or what medication or vaccine they're having. And we kind of need to do that. But it is bringing out some tricky politics and some tricky aspects that hopefully we can learn from that as well, because I think we're more intolerant than we've ever been before. You walk down the street and someone wasn't wearing a mask and you go, "Oh, you wasn't wearing a mask." And I get that, because people not wearing a mask has an implication on other people. But I wouldn't mind us getting back to the kind of situation where we're a little bit more tolerant of different people's beliefs. And I suppose, again, one of my slight nuances is that I really do hope that, because I'm a doctor saying go out and get vaccinated. Big surprise. The anti-vax movement is broad. There are some people that I would label as badly misinformed, on the spectrum toward mad, but there's also people that are just anxious and concerned with really understandable concerns. And I think that it's our job, and hopefully this podcast helps to some degree, to inform those people, for it to be a discussion rather than us just saying, "You haven't been vaccinated, you're bad. You have been vaccinated, you're good." I don't see it as that simple. As a doctor, you see people who make decisions that are different to mine all the time. I say, "Look, I think you should take that statin." They say, "I don't want to." I don't see them as a criminal. That's decision making. Whereas with this, partly because the effects of an individual has an effect on the community, but we're going to need to get that tolerance back, and even when they're things that we really disagree with.
What a good finale. Thanks, Andre. That was really good. I think it answered a lot of personal questions, and hopefully to the listeners, it gave you a greater insight as to what COVID is, what the vaccines are, and how it affects your cardiology, but also your overall health. If you do enjoy this podcast, please leave a review on the iTunes store, share it with a friend, and if you've got any questions, you can send us an email or leave a comment on social media. Thanks, Andre.
Thanks, Alex.